Run It Studios and the Arthritis Foundation of Missouri bring you this special episode of the Run Radio Podcast. Welcome back to the Run Radio Podcast, our partnership with the Arthritis Foundation of Missouri, bringing you resources to help you and your loved ones dealing with rheumatology type conditions like juvenile rheumatoid arthritis, rheumatoid arthritis as an adult, and so on. I want to welcome my guest today, Michael Paley. Dr. Michael Paley, welcome.
Oh, thanks for having me.
Yeah, thanks for being here. Many people that are listening to this either know somebody or have a condition themselves that they deal with on the day-to-day. Mine was diagnosed at 6 years old, and that was juvenile rheumatoid arthritis. So people like you are important in our lives. So why did you decide to study such diseases?
That's a good question. I don't think I actually made this decision explicitly. It was more when we were deciding what specialties to pursue. You know, I always wanted to go into medicine because I like talking to people and having long, sort of lifelong interactions with patients. And then it was at the first year of residency, you have to save all your interesting cases to present to your colleagues, about what you want to, teach them about if you saw like an interesting case.
Yeah.
And even though my first year I thought I wanted to go into pulmonary medicine, like be a lung doctor, at the end of the year I found out that all the cases I had saved were rheumatology cases. So it was just kind of like an unintentional or unconscious awakening that I had.
Yeah.
That I realized that I really liked the rheumatology because of the immunology and, the patients, I guess.
So you've done a lot of work, not just with patients one-on-one, but also research and even teaching that research to others. What's that been like?
I mean, it's great. I really like the ability to kind of push the boundaries of our knowledge. And I think when I started rheumatology, there was just so much need in the field, right? Like we are picking medications not because we know which one is going to work for the patient, but because that's what their insurance provider will approve, or maybe that's just because the medication we've been using the longest, so we're the most familiar with it, not because it's necessarily a better chance at working. And so I think there's so much opportunity. And I really like the research allows us to maybe solve some of those problems for patients. And then, bringing it back when I can tell some of my patients, like some of the work that we're doing or new clinical trials that have come out, their excitement for new therapies and new options for them is just palpable. So I really enjoy that.
What's something that you could share with the audience that we may not know, but you've discovered through a lot of your research that would be interesting to us?
Yeah, so I think for a long time, even when we started, like when I started rheumatology fellowship, the patients would always ask, well, if you give them a diagnosis, right, of rheumatoid arthritis or psoriatic arthritis or what have you, most of them would ask, well, how did I get this in some shape or form? Was it something that I ate or something that I did? And a lot of the doctors, would kind of say, we don't really know, or they would give some sort of vague explanation of, well, you got infected with some sort of microbe and then your immune system went haywire and then now it's like attacking your own body. But like nobody really knew. Right? It was just this, vague, hand wavy kind of explanation. And so I think what we've been really excited about and some of the discoveries that we've made at WashU is actually we've actually narrowed down and are starting to find like the immune cells in specific diseases that are attacking the body and causing the inflammation. And so, academically, that's like super cool because we can figure out like how you get it. But there also are now companies that are developing therapies to specifically target just those cells instead of just blanket suppress the immune system.
Yeah.
And there are early signs that that is a feasible and potentially effective strategy. So I think it's just, I think rheumatology may be at the forefront of a revolution in terms of potential therapies. So I think it's a very exciting time.
what I feel like that is very beneficial for someone early on getting diagnosed. But what about somebody like me or other people that have, been dealing with it for a while? Is there hope for us to benefit from that too?
Yeah, so the case report that made a really big splash for this new therapy was actually somebody who had the disease that they were treating at the time is called ankylosing spondylitis, and this person had disease for about 30 years. So not a newcomer to the
Yeah.
disease, right? That patient had gotten, 10 to 20 years of just NSAIDs because that was available, and then TNF inhibitors for a while, and had the arthritis had progressed so much that he had to have a hip replacement because it had destroyed his hip, right? These are like common stories for people that have had arthritis for many decades because they were diagnosed well before we had all the therapies that we have today. Uh, and this person got started on this new therapy, and the report is that he was able to get off his TNF inhibitor, like off his other immunosuppression, and start on this new therapy. The disease-causing cells went away, and the measurements that they reported in terms of his disease activity all went down. So not only is he like having less disease burden, but he also has less risk because the therapy is not as immunosuppressive. And that's in
Wow.
somebody that has long-standing disease.
Yeah, that's very exciting. So then, if those are starting to roll out in reports, how long does it take from there to actually hit somebody like me or other patients out there going, yes, please?
Yeah, I would love it to be tomorrow,
Yeah.
but unfortunately, with the way, because of the way that we want to make sure that when we develop these molecules, we want to make sure that they're safe as well and effective, and with rigorous scientific testing before we, launch them into the wilderness. I think it may take several more years because, there was just a phase 2 trial and with this molecule that wrapped up that was reported, but we haven't seen any phase 3 larger studies, and then you would need, submission and approval from the FDA. So that, I mean, that's a whole process that takes a while. But I think even though we don't have these drugs right around the corner, I'm still pretty optimistic about the future.
Yeah, that is promising. That's really exciting. What are some of the other studies that you've immersed yourself in that have really, felt good to learn about?
Um, in terms of like what other groups are doing, or the other
Sure.
things that
Or
we've
just
done in our lab.
anything. It's also interesting because, we talk to our doctors all the time, but to know, kind of some of the other things that you're seeing is very interesting just to kind of see from that perspective and look through that lens.
Yeah. So I think that's a good question. I am so hyper focused on the ankylosing spondylitis and the and uveitis. But I think what else has been exciting for me? Um, you know, I think I think the really like hot and sexy thing now that they are testing in rheumatology patients is a technology called CAR T cells that you may have heard of. They're not like cars, like they got their own engine and 4 wheels and they can run on the road, but the CAR stands for chimeric antigen receptor. And basically, what the concept behind this is very interesting. Is it takes your immune system and introduces a new gene into the cells to redirect them towards whatever target you want them to attack. So this technology was initially developed for cancer patients in oncology and has been super effective for patients that have cancers from B cells, um, like lymphoma or leukemias. But we use B cell depletion strategies in rheumatology, in rheumatoid arthritis, or in lupus, or in other diseases. And so sometimes those strategies are not necessarily effective, and people are thinking that's because the drugs that we use are just not as potent as we need them to be.
Hmm.
And so these CAR T cells are sort of living drugs that are much more effective at deleting or destroying whatever you set them against. And so there are some clinical trials now going on with these CAR T cells to destroy B cells much more profoundly in severe diseases like lupus and lupus nephritis, for which we don't have tons of. We have some new therapies in the past decade, but it's not a ton.
Yeah.
So I think that's another exciting sort of forefront that we're exploring as a field. Me, not personally, but my colleagues.
Excellent. What about being involved with the Jingle Bell Run? You are an medical honoree this year, so congratulations. That's cool.
Thank you. Yeah, I'm looking forward to that.
How did you get started with Arthritis Foundation of Missouri?
Uh, I think we've always sort of been connected. The Arthritis Foundation runs a fundraiser every year called the Silver Ball, which we um, as community of WashU, we go and support to show our support for the Arthritis Foundation. And then, I met Dolores, the CEO, and she's phenomenal. And so I think I guess we just really connected and hit it off.
That's great. What else would you like patients to know that as a rheumatologist, I feel like having a great rheumatologist in your corner is a game changer. And being able to work with patients and have a good relationship, is very important. But what's something we could do to make the communication even better?
Like between doctors and patients.
Yeah.
Yeah, it's I think what is helpful, most of the things that patients ask me about that they feel like they're in need of is a great support network, finding other people like them, which is really key. And I know that there's a bunch of different advocacy groups and patient groups that really work to do this, because I think finding other people that are in your same situation is really helpful in terms of coping, especially with a new diagnosis and a chronic condition. And I think those are the best venues for patient education and communication that's outside of the doctor's office.
Mm-hmm.
Because I think, when you go to the doctor's office, there's lots of objectives, right? Like you got to talk about like how you're doing and talk about how the drugs are going and whether you're getting them on time and talking about blood work and all that stuff. There's not always that space for exploring sort of like the education or how the disease works and affects you on like a day-to-day basis, or what's causing this symptom or that symptom necessarily. In that like compressed doctor's visit.
Yeah.
And sometimes I think patients have really found great solutions or resources when they talk to other people that have like tried out like 10 20 different things, and they're like, oh, what really worked for me for this condition was that. And that sort of like trial and error stuff is invaluable.
Yeah. And that's something that I think the Arthritis Foundation is doing a really good job
Yeah,
too,
I agree.
providing those resources and connections too. What's something that you would like patients to know? Like, there's a lot of information out there, and I feel like it can be hard for someone that's new to advocating for themselves or maybe their child or whatever. What are some tips that you would give them on making sure they're getting valid, good information?
Oh, you mean because the internet is full of websites and information, and you don't know what's true and what's
Yeah,
not?
because people get desperate. They have hope that they're going to find some magic solution on crazycrazy.com and hope that it's great, and not always great.
Yeah. I think I agree. I think there's a couple of things, right? Like one is like as a doctor, I always try to remain humble about like all the stuff that the medical world actually knows and a lot of the stuff what the medical world doesn't know. But I think you gotta, when you're reading something and it looks really exciting, you gotta ask yourself if it was this effective of a solution or this easy of a solution, why has nobody talked about it with me? Um, like if it's too good to be true, that should like ring some alarm bells when you're looking at it.
Yeah.
Because there's good stuff out there, but um, I think you just got to be a little bit, uh, you know, take everything with a grain of salt and like, see how, and if it depends like where it's coming from, right? If it's coming from like the Harvard Medical School arthritis website, um, versus, the bird.com. Like, I don't know.
Yeah. I gotcha. I feel you. Yeah. What we talked about some of the long-term things that could be coming up that are very exciting about, but let's talk a little bit shorter term. What do you see happening for arthritis in the next maybe even 3 years? Do you see anything major happening, or do you just see incremental, advances happening?
Um, yeah, I think people these days are very familiar with the concept that it seems like, there are centuries where nothing changed, and then there are days when, a whole bunch of activity, like an entire century of change
Yeah.
happens. So I think that happens, progress happens in bursts. I think one of the things that we're kind of interested in is developing new diagnostic tests and do new diagnostic tools for uh, clinicians like rheumatologists to really help them better understand like who has true disease and if it's active and who doesn't, especially capturing people with early disease. And I think that's a real challenge in rheumatology, like getting an early diagnosis. I can't tell you the number of times that people have come into my office and told me that they've been bouncing around between doctors for 2, 3, 5 years or more,
Mm.
um, before they actually get a diagnosis. And that's not necessarily the fault of the doctors that they were seeing because, rheumatology is a relatively set of rare conditions that, are not always at the forefront of, primary's minds and that sort of thing. So I think helping support that process, accelerating them to like getting into the right room, the right doctor at the right time. Um, I think we're working on that, and I think we might be able to come out with something in the next couple of years for like ankylosing spondylitis and stuff like that. That would be sort of emblematic of multiple other diseases. But I think that's one of the things that we're thinking about that would be a short-term change.
If someone is suspecting that they're experiencing something where they do need to see a rheumatologist, what are some of the best notes that they can document to take to their primary care doctor to get that referral?
Oh yeah. So I mean the most common thing I think that like lands you with a referral to a rheumatologist office is the quality of the joint pain that you have, right? Because there's lots of people out in the world and there's lots of people that have pain in their hands or their feet or their back and so on. But I think the idea of the, what type of arthritis you may be experiencing is really helpful to help you get into a rheumatologist's office. Because if you surveyed 100 people on the street, most of those people would the type of arthritis they would have would be osteoarthritis, which is sort of the type of arthritis that almost everybody gets if they live long enough. But the rare patient that really, really, really truly belongs in the rheumatologist's office and nowhere else is people that have inflammatory arthritis, right? So you have stiffness in your joints in the morning that last 30 to 60 or minutes or more, and your joints are swollen, and the feeling of stiff, or I think those are really key because and the fact that your arthritis gets better as you use your joints, um, and gets worse if you just are laying around or sitting around. Those are big difference between the arthritis that comes from inflammation and the arthritis that comes from, just in the general population.
Yeah, good stuff. All right. Anything else that I haven't thought to ask that you could share?
I don't think so. Just that it's a bright future ahead of us.
That's very good. And thank you for your contribution to making it better.
Oh, well, thank you. Thank you for having me.
Yes, you can find out more about the Arthritis Foundation of Missouri at arthritis.org and link over to whichever location is closest to you. And of course, catch all of our videos by linking over to your preferred platform from runradio.net. Thank you so much.
Thank you.